Good morning, everyone. My name is Sarah Frasure, and I'm an assistant professor of emergency medicine at George Washington University Hospital. Today, we're going to be talking about transabdominal OB ultrasound, which is one of my favorite sonographic applications for point-of-care ultrasound in the emergency department. The topics of conversation will include the indications, the technique, the focus questions that we ask every time we perform a transabdominal OB ultrasound, including how to differentiate an IUP or intrauterine pregnancy from no definitive intrauterine pregnancy, the number of babies, the fetal heartbeat, and how to calculate the gestational age. We'll also touch briefly on some of the limitations of point-of-care transabdominal OB ultrasound. Why does this matter? Well, it matters because ruptured ectopic pregnancies kill women, and the prevalence of an ectopic pregnancy in emergency department patients who present with bleeding or abdominal pain ranges from 6 to 16%, which is much higher than the general population. Risk factors for ectopic pregnancies include prior ectopic pregnancies, pelvic inflammatory disease such as chlamydia or gonorrhea, induced abortions, intrauterine devices or IUDs, and a history of smoking. The questions that I ask myself every time I perform a transabdominal OB ultrasound include, do I see an IUP on my ultrasound? If I do, how many babies are there? What is the fetal heart rate? What is the gestational age? If I don't see an intrauterine pregnancy and I have a patient with severe abdominal pain or unstable vital signs, do I see any free fluid in the abdomen, concerning for a ruptured ectopic pregnancy? There are several types of transducers on most ultrasound machines. In order to perform a transabdominal OB ultrasound, you will generally pick either the phased array or the curvilinear probe. Should you be performing a transvaginal ultrasound to assess for an intrauterine pregnancy, you would choose the endocavitary probe. You would like to obtain two views, a transverse view featured here with the probe marker pointed towards the patient's right, and a longitudinal view or sagittal view with the probe marker pointed towards the patient's head. If possible, have the patient fill their bladder before performing a transabdominal ultrasound in order to use the bladder as your acoustic window for a better view of the uterus. The sagittal or longitudinal view will look like this. First, you'll see the bladder, followed by the uterus and vaginal stripe. Posterior to the uterus, you'll find the pouch of Douglas. This is where free fluid will accumulate first. What does this look like on ultrasound? Here's an example using the curvilinear probe. Initially, we'll see the bladder, followed by the vaginal stripe and uterus, and then our pouch of Douglas posterior to the uterus, where we would be looking for free fluid. The transverse view will find the bladder first, followed by the uterus, and posterior to the uterus again, the pouch of Douglas. This is what this will look like on ultrasound. In a transverse view, first you'll find a small bladder in this case, or empty bladder I should say, followed by our uterus, and then posterior to the uterus, the pouch of Douglas, where again you will be looking for free fluid, particularly if you're concerned about a ruptured ectopic pregnancy. Remember, with the transverse view, you want to have the probe marker pointed towards the patient's right side. So the first question that you want to ask yourself every time you perform a transabdominal OB ultrasound is whether you see an intrauterine pregnancy or IUP. When performing a transabdominal OB ultrasound, you'll generally see an intrauterine pregnancy after 6 weeks. Initially, you'll find a gestational sac within the uterus. This is a hypoechoic or black sac and is a marker of early pregnancy. However, this is not going to be diagnostic of an intrauterine pregnancy because ectopic pregnancies can also have a pseudogestational sac. In order to diagnose an intrauterine pregnancy, or IUP, you must either find a yolk sac, which looks like a Cheerio, inside the hypoechoic or black gestational sac, or a fetal pole with cardiac activity. Generally, you should see a yolk sac followed by a fetal pole after approximately 6 to 6.5 weeks of pregnancy using a transabdominal approach. You will see yolk sacs and fetal poles earlier with a transvaginal ultrasound. So let's look at a few different images to determine whether we see an intrauterine pregnancy or not. So here's a nice view. This is a curvilinear probe. We have the uterus in a longitudinal or sagittal approach, and we see a very large hypoechoic gestational sac. Within that gestational sac, we see our Cheerio. This is known as the yolk sac. So this is an example of an intrauterine pregnancy. Here is a transverse curvilinear image of a uterus. Remember, in the transverse view, the probe marker is going to point towards the patient's right side. Within the uterus, we have a large hypoechoic or black gestational sac, and we can make out a fetal pole. If you look closely, you'll actually see cardiac activity. So this is a nice example of an intrauterine pregnancy with a fetal pole and cardiac activity. Here's another transverse view using the curvilinear probe of a uterus. So we see the uterus, and within the uterus we see a black or hypoechoic gestational sac. Do you see anything inside this gestational sac? Neither do I. Therefore, we do not definitively have an intrauterine pregnancy. There could be a couple of different reasons for this. So the differential diagnosis in this case includes a very early pregnancy, perhaps 4 to 5 weeks along, where you aren't going to be able to visualize that yolk sac on a transabdominal OB ultrasound. Or this could be an ectopic pregnancy with a pseudogestational sac. Patients in whom you have a positive HCG and a transabdominal OB ultrasound with an empty gestational sac need to have a transvaginal ultrasound to further diagnose whether this patient has an intrauterine pregnancy or potentially an ectopic pregnancy. So the next question you want to ask yourself is, how many babies do you see? Most of the time you will find one yolk sac or one fetal pole indicative of one intrauterine pregnancy. However, occasionally you will come across 2 or more yolk sacs, which will be a surprise to you as well as generally to the mom. So here's an example of 2 yolk sacs. So this is a patient who has twins. Here's another example of 2 yolk sacs. And another example of 2 babies within one uterus. And here's an example of 3. So this is something that I've never seen. I have come across twins quite a few times. I've never diagnosed triplets, but there's always a first, so be on the lookout. All right, let's talk about the fetal heartbeat. So in order to measure the fetal heartbeat, you want to use M mode. M in M mode stands for motion over time. Generally, if you can see a fetal pole, you should be able to see cardiac activity, and this is when you can measure the fetal heart rate. This is generally visible at some point after 6 weeks of pregnancy. The fetal heart rate should be greater than 100. If the fetal heart rate is less than 100 at 6 weeks, there is a very high risk of miscarriage in these patients. You never want to use Doppler to measure the fetal heartbeat due to the theoretical risk of fetal tissue heating. Again, anytime you want to measure the fetal heart rate, please use M mode. Let's talk about the gestational age. There are a couple of different ways to calculate the gestational age. In the first trimester, you want to use the crown rump length calculation. Essentially, you're going to measure the length of the fetal pole from crown or head to rump. This is very easy, and all of our ultrasound machines have an OB calculation package which will convert the length that you measure into a gestational age. In the second or third trimester, babies are generally too large for the crown rump length measurement, and you have a couple of different options. These include taking a measurement of the biparietal diameter, the abdominal circumference, or the femur length. Of these three measurements, my preferred option is the femur length. This is one of the easier ways to calculate gestational dating or gestational age in the second and third trimester. So here's a nice example of a crown rump length measurement in a patient in their first trimester. So you can see that we have taken a measurement from end to end of the fetal pole, and our ultrasound has converted the crown rump length of 1 centimeter into 7 week, 1 day for our gestational age. Again, if you see a crown rump length greater than 7 millimeters, you should also be able to detect a fetal heart rate. If you don't see a fetal heart rate and you do see a fetal pole, consider fetal demise and obtain a transvaginal ultrasound. Furthermore, if you are calculating a fetal heart rate and it is less than 100, in particular if it is less than 70, this is 100% predictive of a miscarriage. When you are measuring the crown rump length, do not include the yolk sac in your measurement. Here's another example of a crown rump length measurement. This fetus is 12 weeks and 4 days based on our crown rump length of almost 6 centimeters. In the second and third trimester, you want to use either biparietal diameter, abdominal circumference, or femur length. Biparietal diameter should be measured on an axial plane that traverses the thalami and the cavum septum pellucidum. The calipers should be placed at the outer edge of the near calvarial wall, which is closest to the top of the ultrasound, and the inner edge of the far calvarial wall. This can be a difficult measurement to obtain because the patient's or the head of the fetus has to be in a specific position in order to see the thalami. Here you can see the biparietal diameter is measured out into a gestational age of 27 weeks and 5 days. Femur length is my preferred option for second and third trimester gestational dating. You can look around until you find a nice view of the femur and then hit the pause button or freeze button. Then you can use your measurement calipers in order to find the femur length. Here you can see that the femur length has been converted into a gestational age of 18 weeks and 3 days. In summary, if you have a patient in the emergency department with a positive HCG and you do see an intrauterine pregnancy on your transabdominal OB ultrasound with either a yolk sac or a fetal pole, then you know you have an intrauterine pregnancy. However, if you have a positive HCG and you don't see an intrauterine pregnancy on your transabdominal OB ultrasound, that is, you see a gestational sac, but within that gestational sac you don't see either a yolk sac or a fetal pole, this is a patient who needs to have a transvaginal ultrasound to further assess what might be going on. They may have a very early IUP, and you were unable to visualize the yolk sac on the transabdominal ultrasound, or they may have an ectopic pregnancy. There are several limitations that we need to consider when performing a transabdominal OB ultrasound. An empty gestational sac can be many different things. Certainly, most likely, an early intrauterine pregnancy that we just can't see yet on transabdominal ultrasound. However, an empty gestational sac could also mean that this patient has an ectopic pregnancy, or if they've been bleeding for several days, a missed abortion, and thus no contents in the gestational sac. Always ask women about IVF. IVF carries a much higher risk for something called a heterotopic pregnancy, which is where you have one pregnancy in the uterus and another pregnancy somewhere else. All patients undergoing IVF should get comprehensive imaging in the radiology department to look for the possibility of a heterotopic pregnancy. Ovaries can be visualized on transabdominal OB ultrasound, and I will show you a few pictures of what an ovary looks like. I will say, however, that if you are very concerned about ovarian pathology, in particular either ovarian torsion, intermittent torsion, or a tubo-ovarian abscess, you should obtain a comprehensive transvaginal ultrasound in order to further delineate ovarian pathology. So ovaries tend to look like chocolate chip cookies, where you see lots of small hypoechoic or black cysts. These are follicles. Generally, what you want to do in order to look for the right ovary, for example, is slide the probe to the patient's left side and then shoot through the full bladder to get to the right ovary. You want to do the opposite approach to look for the left ovary. The bladder is incredibly important and really useful as an acoustic window, not only to further visualize the uterus, but to find and visualize the ovaries. Ovaries are generally found anterior and medial to the iliac vessels. Here's a nice example of an ovary with multiple follicular cysts, and this is why we say that it looks like a chocolate chip cookie. So let's talk about a few cases where we'll go through different types of video clips to determine whether we think the patient has an intrauterine pregnancy or no definitive intrauterine pregnancy, which again could mean a very early pregnancy that we just can't see yet on transabdominal ultrasound, or potentially an ectopic pregnancy. So here's a nice example of a transabdominal OB ultrasound using the curvilinear probe in the longitudinal position. On the right side of the screen, you see a uterus with a large hypoechoic or black gestational sac. And within that gestational sac, we see a beautiful Cheerio or yolk sac. So this is a patient who has an intrauterine pregnancy. To the left of the screen, you will note peristalsis of the bowel. Here's a nice transabdominal OB ultrasound using the curvilinear probe in the transverse view with the probe marker pointed towards the patient's right. We see a uterus. Within that uterus, we see a hypoechoic or black gestational sac. And within the gestational sac, we see a fetal pole. If we look closely, we can also visualize cardiac activity. This is a patient who has an intrauterine pregnancy. Here's an example of a transabdominal OB ultrasound using a curvilinear probe in the transverse view, and we see a uterus. This is a patient with a positive HCG, and we see a hypoechoic or black gestational sac. Do you see any contents within the gestational sac to suggest an intrauterine pregnancy? Neither do I. Now consider that her blood pressure is 80/40, and she has severe abdominal pain with this positive HCG. The differential diagnosis includes a ruptured ectopic pregnancy, and so the next thing we want to do is check for free fluid. If you don't see free fluid posterior to the uterus in the pouch of Douglas, Head for the right upper quadrant. So what do we see now? This is a great view of a right upper quadrant. We see the liver, the kidney, and Morrison's pouch. And within Morrison's pouch, we see a hypoechoic or black stripe of fluid, which is indicative of blood in the abdominal cavity. This patient was taken to the operating room with 500 cc's of blood in her abdomen after we called OB after performing a point of care transabdominal OB ultrasound. So here's another patient who presents to the emergency department with a positive HCG. And we see a uterus. Within the uterus, we see our hypoechoic or black gestational sac. Do we have an IUP? We certainly do. So here we actually have a patient who is in her second trimester. We see a fetus that is moving around. If we check the cardiac activity, we could use M mode to calculate our cardiac activity with a better view. And certainly we could see if we can find a nice image of the femur in order to calculate femur length and provide the patient with the gestational age of the fetus. All right, here's another example of a transabdominal OB ultrasound. This is a patient with a positive HCG and abdominal pain. What do we see here? So to the right of the screen, coming in the view at the very end of the clip, we see a uterus. The uterus is not fully visualized, but we don't see anything inside the uterus. It does appear empty from what we can see. And then to the left of the uterus, we see what looks like a gestational sac with a fetal pole. So this is an example of an ectopic pregnancy. If you look closely, you'll also see free fluid, hypoechoic black fluid, between the uterus and this ectopic pregnancy. So this is a patient with a ruptured ectopic pregnancy that was diagnosed on transabdominal OB ultrasound. All right, here we have a transabdominal transverse ultrasound of a patient in the emergency department with a positive HCG and abdominal pain. And as we fan through, the first thing we notice is the hypoechoic bladder on top. Posterior to the bladder, we see the uterus coming into view there. And what do you see inside the uterus? So we certainly don't see a gestational sac, but we do see an IUD. IUDs are strongly reflective on ultrasound, and you can see the IUD as you fan through the uterus in this video clip. So in a patient with an IUD and a positive HCG, we have a very high risk for an ectopic pregnancy. So this is a patient who needs a transvaginal ultrasound. All right, finally, we have a patient who presents to the emergency department with a positive HCG. Home pregnancy test was positive, and now she comes to the ED because she's having abdominal pain. This is a curvilinear transabdominal OB ultrasound looking at the uterus, and we are in the longitudinal position. We see the bladder to the right, small bladder to the right of the screen at the very end of the clip, and then we see the uterus as we're fanning through. And this is a great example of a molar pregnancy. I've only seen this once. This image was taken my 4th year in residency. We had a patient come with abdominal pain and an HCG of 200,000, serum HCG of 200,000, and she had a molar pregnancy. So just in case you ever see the snowstorm appearance or grapes, I think it's called, a group of grapes or a bunch of grapes in the uterus, this is a patient with a molar pregnancy. So I hope that this was a useful lecture looking at the indications to perform a point of care transabdominal OB ultrasound. Remember that you're always looking to diagnose an intrauterine pregnancy, either by seeing a yolk sac or a fetal pole. Remember that you want to count the number of babies. You want to determine the fetal heart rate using M mode, or motion over time. And you can actually calculate the gestational age by measuring the crown rump length in the first trimester, or in the second or third trimester, the biparietal diameter, abdominal circumference, or my preferred option, which would be femur length.